Hi!
Hi, I'm Dr. Ramya Valiveru. I'm a breast and endocrine surgeon and oncologist practicing in Hyderabad. How is chemotherapy and radiation helpful in the treatment of breast cancer? So to understand this, let us classify the treatment into loco-regional, that is local, regional, as well as systemic treatments. So surgery and radiation are the loco-regional treatments, and the systemic therapy is given in the form of either anti-cancer chemotherapy, hormonal therapy, targeted therapy, or immunotherapy. So we know that the cancer cells might start in one place in the organ that it is affected. In the case of breast cancer, they begin in the glandular tissue of the breast, but they might spread into the other parts of the body where they can grow later. So in order to target these cells that might have gone far away, we have to give drugs that can get absorbed into the bloodstream and reach through the blood to those cells that might have gone far. So this is called a systemic treatment. In general, the chemotherapy or the anti-cancer therapy that we give is given in the form of injections through the veins. Rarely, it can also be given as tablets, which also get absorbed into the bloodstream from the gastrointestinal tract. There is another form of therapy called hormonal therapy, which is given in the form of tablets or injections, which go and target the hormonal receptors that might be being overexpressed by these cancer cells. Targeted therapy targets the specific proteins that the cancer cells are using to multiply and survive. Immunotherapy is a form of systemic therapy where we use drugs or proteins that increase the immunity of the body to help them fight the cancer cells. That is about systemic therapy. Now coming to loco-regional therapy, we know that surgery is a form of treatment and it is used in stage 1 to 3 breast cancer. In stage 4, systemic therapy is given. Whereas in stage 1 to 3 patients, in certain situations like when we perform breast conservation surgery or if the disease is extensive within the breast and in the regional lymph nodes, we have to give additional treatment called as radiation therapy. This is high energy X-rays or particles that are targeted onto the tumor site or the remaining breast to decrease the chance of it coming back, because there could be some microscopic components that might be left behind or that might have not gone unnoticed in the current imaging or tests. So chemotherapy and radiation therapy have helped surgical treatment of breast cancer give good outcomes, and we are able to perform less extensive surgeries and give good survival to the patients. So don't be scared of these kind of treatments, just understand why they are being given to the patient. Thank you.